Good evening, everyone. We are live now. Good evening. We are live now, everyone. Good evening. How are you all? Good evening. So once everyone joins, we'll discuss the INICET exam pediatrics session. And there were almost more than 10 questions in the INICET exam. And I'll just check how many of you are here. So good evening, all of you. Hi, everyone. Hi, Dr. Kirti. Hi, Dr. Mahmood. Hello, everyone. Good evening. So we'll just wait for everyone to log in and join. All of you, can you hear me? Can you see me clearly? So how was your INICET exam? How was it? Difficult? Easy? How was it, everyone? Hi, Dr. Zoya. Hi, Dr. Nath. Hi, Dr. Pavni. How's everyone? Hi, Dr. Zoya. Is this your real name? Yes. Hi, Dr. Kriti. So we'll just start once everyone joins. So how was your exam first? So first of all, let me know how your exam was. Moderate. Dr. Kriti says moderate. So yeah, not too difficult, but not too easy either. Vishwanath says fine. What else? All of you. So how was your pediatrics? Let's talk about pediatrics in your INICET exam. So how was pediatrics specifically? So I checked with many students and I found that there were more than 10 questions of pediatrics in your exam, and I'll be showing you those 10 questions today. Some Dr. Kriti says some options were tricky. Yes, they are. As you expect in any INICET exam, they are not actually so easy. Okay, so you will always have tricky options, and sometimes they will trick you with some simple change in the sentence. So yeah, you have to give it carefully. So it's not like a very easy exam always. So it keeps on changing. So let's start with the first question. Now that a few of you have joined, we'll maybe one more minute and then we'll start the discussion. Of course, always in your exam, it is good that you're able to narrow down to two options. But, yes, you need, in addition to common sense, you need some facts. So, and I can tell you that whatever, comes in the exam, it mostly comes from the notes only. You just need to revise. You might not get the same sentence, which I told you, but, the trick to solve the question will be always there in your notes. So if you ask me what is the crux is to revise your notes. Okay, you will not get the same question which came in the last exam, but yes, in this INICET exam, there were some similar questions which came in the last INICET as well. However, yes, you need to remember and revise, keep revising your notes. Okay, and Dr. Kriti is saying that she read our pediatrics DAMS notes in the morning, and the same milestones came in the AIIMS exam. Good, Dr. Kriti. In fact, the milestones question was one of the easiest question which ever came in INICET exam. Otherwise, they would give difficult milestone questions. Now, this was a very simple milestones question. What else do you want? Huh? Social smile, pincer grasp. हाँ इससे easy क्या हो सकता है? Okay, so let's start. So the first question was on, so yes, Dr. Viraj, let's start. So first question was on seizures and neonates is increased by. Okay, so all of you, can you tell me if you feel that there was some change in the options? I'll change that. But this is what I learned, that these were the four options in your exam: hypomagnesemia, hyponatremia, hypernatremia, and hypocalcemia. And there was one option of all of the above as well. So all of you, do you agree with me? All of you, do you agree with me that there was one option of all of above as well? Dr. Sharif, I'll tell you the answer. Hold on. But is the question okay? Was the same question in your exam? So everyone agrees with me that there was one question on what, all of above as well. And students, remember that we have already discussed in all of your DAMS classes multiple times, that of course, if I talk about the most common cause of seizures in a neonate, HIE. HIE is the most common cause of seizure in a neonate. After that, metabolic defects are common. After that, metabolic defects are common. Okay, like hypoglycemia. So, the most common cause would be HIE, followed by hypoglycemia. Then you get hypocalcemia, hypomagnesemia, okay, and even hyponatremia. So all of them are true. And now let's talk about India. Now in India, students, when mothers are not, it's so hot in some parts of our country. Even in Delhi, it's so hot, and some mothers are not able to feed their babies well. So very commonly, I have seen in my practice at least once a month a child of hypernatremic dehydration. Mother is not able to feed her baby well, and the baby comes to us with severe hypernatremic dehydration. So the answer of this question is all of above, especially in India. And even some neonates with diabetes insipidus, or nephrogenic diabetes insipidus, they come to us with hypernatremic dehydration. Okay, so there's no doubt about this. The answer of this question was D. Okay. So Dr. Sharif, the answer was all of above. Let's take you to the next question. Okay. The next question was, arrange all of them in decreasing order of mortality in neonates. So you were supposed to move the cursor and arrange all of them in the decreasing order of mortality. So can any of you tell me? Yes, we just started, Dr. Varsha. That was the first question for the day. So can anyone tell me, how do you arrange these four in decreasing and in fact this was a repeat question. If all of you had seen the last INICET explanation by me, in the last INICET explanation, I showed you the under 5 mortality. So last INICET exam was all about what is the four major causes of under 5 mortality. And now they are talking about the four major causes of mortality in neonates. Anyone in the class? Anyone in the class? What would be the answer here? Anyone in the class? What would be the answer here? Anyone? What would be the answer here? So all of you should know that according to the WHO, and this was published in the Lancet. There's a very big journal called Lancet, and it published that. Let me tell you what came in the last INICET exam. In the last INICET exam, they talked about 1 to 59 months. In the last INICET exam, the most common cause of mortality between 1 to 59 months was pneumonia. Number 1, pneumonia. Number 2, diarrhea. First, I'll tell you more than 1 month. Pneumonia, diarrhea, okay, malaria, injury. So in fact, injury, malaria. So I'll just repeat it for you. Last INICET, under 5 mortality, pneumonia, diarrhea, injury, malaria. Okay, pneumonia, diarrhea, injury, malaria. Now let me take you to the neonatal deaths. let me take you to the neonatal deaths. And the neonatal deaths, the most common cause of neonatal death is prematurity, followed by intrapartum events like asphyxia. Okay, so as you can see, prematurity followed by intrapartum events like asphyxia. Number 3, sepsis meningitis. Okay, and number 4, congenital. Now I'll repeat for you: prematurity, intrapartum events like asphyxia, sepsis meningitis, congenital. Okay, okay. So what I'll do is I'll show you the next question. So this was the answer of the question. Prematurity, birth asphyxia, sepsis, congenital anomalies. And 2, 3, 4, 1. Yeah, you are right, Dr. Vishak, you are right. Yes, the answer was 2, 3, 4, 1. Okay. All of you agree with me about this question? So all of you should know about the under 5 mortality. Okay, you should know what are the causes of under 5 mortality in children less than 1 month and children between 1 month to 59 months. So we have discussed this in our last, all the test series, all the INICET discussions. We did discuss about this. Let's take you to the next question. And the next question is a simple question. Next question is a simple question. Now match the milestones. It was all about matching the milestones. So all of you, can you tell me? It's a simple question. इससे simple सवाल आज तक कभी नहीं आया. Trust me. I have been following the INICET, the AIIMS exam, the All India PG exam since almost 2 decades now. Okay, I am a faculty in Pediatrics and DAM since almost 20 years. And इससे simple सवाल कभी नहीं देखा मैंने. You always expect something more than this. Okay, so social smile, of course, is at almost 2 months of life. So social smile is of course at 2 months of life. Pincer grasp is 9 to 12 months. So pincer grasp is 9 to 12 months. So it comes at 9 months, it becomes mature at 12 months of life. Now a child reaches for objects. A child reaches for objects at almost 5 to 6 months. At almost 5 to 6 months of life. Okay. And a child walks. He is able to, walk with a finger held. He is able to walk with 1 or 2 steps at almost 1 year of life. So yeah, you're right, Dr. Vishak. So a child reaches for objects at around 5 to 6 months. He is able to walk 1 or 2 steps at 12 to 13 months of life. Okay, so the answer is this in this way. So this is the answer of my question. So this is the answer of my question. Social smile, pincer grasp. Okay, social smile around 2 months, pincer grasp comes at 9 months, it is mature at 1 year. A child reaches for objects at around 5 to 6 months of life, and a child is able to walk without support at almost 1 year of life. So at almost 1 year of life, a child is able to walk without support, walk with a finger held, walk 1 or 2 steps at 1 year of life. And I've been teaching all of these milestones to you in all of your classes, and I can tell you this is all from the notes. There is no doubt about this because this is such a basic question. Let's take you to another question now. Let's take you to the next question. Now this was a question of more of a common sense kind of question. Can anyone in the class tell me, were the options similar? All of you, I would like to know, were the options similar? At what age child reaches half of the adult size? पहले ऑप्शन तो बता दो, डॉक्टर वैशाख, डॉक्टर Dr. Viraj, Dr. Sharif, Dr. Zova, Viraj. So all of you, at least first tell me what were the options. Because according to me, the students have told us these were the options. See, a child, a term baby is around 50 centimeters. At 1 year of life, a baby becomes 75 centimeters. So a child gains around 25 centimeters in the first year of life. Then around 15 centimeters, so almost 85 to 90 at 2 years of life. Okay. Now, what is the basic adult height? Normally, adult height is around 150 centimeters or so of an average adult. So the answer should be around 2 years. So answer should be around 2 years. It is not mentioned in the books, but yes, if you look at an average adult height of around 150 centimeters, so at almost 2 years you get half of your adult height. Okay, so this is not mentioned anywhere. However, it appears it's a very simple kind of logic कि 2 साल से पे almost आपकी half height होती है. Okay, so Dr. Jyoti, yes, I would go for 24 months, 18 to 24 months. If this was the option, I'll go for the option of 18 to 24 months rather than 24 to 30 months. I'll go for 18 to 24 months. Okay, because at this time he's almost like 75-80 centimeters, so he becomes half of the adult size at this age. Okay, let's take you to the next question. And here's the next question for all of you. Can anyone tell me? Same saturation in all the cardiac chambers is seen in which of the following disorder? These were the exact 4 options which came in your exam. Same saturation in all the cardiac chambers is seen in which of the following disorder? Anyone in the class? Anyone? What do you think? Dr. Ripai, Dr. Ripal has already given her answer. Yes, all of you are right. Look, actually what happens in totally anomalous? What is totally anomalous? Pulmonary venous connection. In totally anomalous pulmonary venous connection, actually what happens, which you can see here on the screen, is that the pulmonary veins anomalously join the right side of the heart. So the pulmonary veins anomalously join the right side of the heart. Okay, they join the right side. So as you can see here, now completely mixed blood is running in the child's body on the right side as well as on the left side. Completely mixed blood. As you can see here, 85% saturation blood is here, 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 everywhere. So the 85% saturation, because the completely mixed blood is running in all the 4 chambers of the child's body in totally anomalous pulmonary venous connection. All the 4 chambers have the same oxygen saturation. It does not happen in any other disorder. Only happens in this disorder. It was again a question of common sense. If you would have imagined that pulmonary veins are joining the right side and all the whole heart will have the same oxygen saturation. Now TGA, TGA is completely different disorder. TGA has 2 circuits of systemic and pulmonary. So there is no doubt TGA is completely a different disorder. In tricuspid atresia also, right side has impure blood and left side has pure blood. So again there is a difference in tricuspid atresia as well as in tetralogy of Fallot. They have a right to left shunt. Why? because they have more impure blood on the right side, pure blood on the left side. Okay, in both tricuspid atresia and tetralogy of Fallot, they have a right to left shunt at the level of ventricle. Okay, now in TAPVC, all the four chambers, since the mixing is above the heart, mixing heart के अंदर नहीं हो रही, it is happening above the heart, so all the four chambers have the same oxygen saturation in totally anomalous pulmonary venous connection. Let's take you to the next question. Now, all of you, can you tell me what was the question exactly? Was it on what is the most common urinary tract obstruction in children? Or most common severe urinary tract obstruction? I want all of you to tell me. And what was the fourth option? Can you tell me the fourth option also? So students, can you tell me the fourth option also? And what was the exact question? Most common urinary tract obstruction in males or most common severe? Was there a severe word? Anyone? Was there a severe word as well? In male babies, most common. No, okay, no severe word was not there. Can anyone tell me? Okay, most common urinary tract obstruction. What about the fourth option? Can anyone tell me the fourth option? What was the fourth option of this question? Anyone? What was the fourth option of this question? See, why am I asking you this question is because overall you should know, देखिए, this is our kidney and kidney is joined via pelvis to the ureter. Okay? And in fact, you know, overall, the most common urinary obstruction is this pelvic-ureteric junction obstruction, PUJ. Some say UPJ obstruction, uretropelvic junction obstruction or pelvic-ureteric junction obstruction. So actually the most common obstruction which we see, and I see one child every day of my life in my institute. I see every day one new baby. So the most common obstructive anomaly is actually pelvic-ureteric junction obstruction. Now, if pelvic-ureteric junction obstruction or uretropelvic junction is not there, then of course your answer is, after this, you will say posterior urethral walls. Okay. So if they had not given, of course, a bladder outlet obstruction, all of you are right. A bladder outlet obstruction is the most common urinary tract obstruction in males after UPJ obstruction or PUJ obstruction. So you should know this. I don't know what no one told me what was the fourth option. Someone is saying fourth option was infection. I don't know about that, but you should know this. Pelvic ureteric junction obstruction or uretropelvic junction obstruction followed by posterior urethral valves. Okay. Yes, you're right, Dr. Ahmed. Chaliye, let's take you further. Now the next question is a question which we always discuss. You know, this is a very common question, and I think this question we recently asked in your many test series as well. A 14-day-old baby has conjunctivitis followed by pneumonia, which shows bilateral infiltrates. The peripheral blood shows some lymphocytic predominance. Okay, so can anyone tell me what were the four options of this question? And is this question framed okay? Is this exact question which came in your exam? What do you think, guys? Did this question come in your exam? And what were the four options? Answer to sabne bata diya. Everyone is right. So yes, Dr. Akila agrees with me. This is the same question which came in your exam. Okay, H influenza. Of course, H influenza does not cause any problem in a newborn. H influenza is gone. Forget about it. Okay. H influenza does not cause any problem in a newborn. Okay. No. You are Abhishek. You are confusing it with another question. So first of all, let me tell you three important points. 3 points. What is the most common cause of ophthalmia neonatorum? Chlamydia. Most common cause of ophthalmia neonatorum is chlamydia. Ophthalmia neonatorum is defined as conjunctivitis within 4 weeks of life. It is defined as conjunctivitis within 4 weeks of life. मैंने कहा most common, but I never said the most common blinding conjunctivitis. If I ask you which is the most common conjunctivitis in a newborn which causes blindness, it's Neisseria. Neisseria is not most common, but it is a blinding conjunctivitis. Okay. Of course, this child has typical conjunctivitis with pneumonitis, which is seen in chlamydia. Okay. No, Sayam, no. That will be too much. Okay. So chlamydia also causes pneumonitis. Chlamydia also causes pneumonitis and conjunctivitis. Okay. So there is no doubt this is chlamydia trachomatis, and we will diagnose this by you can do a swab of the discharges. So in all cases of ophthalmia neonatorum, we look at the discharge and we do a gram stain to look for whether it's diplococci or the gram stain is negative. In chlamydia, the gram stain will be negative. It's a typical case of chlamydia. Okay. Akash is saying in the last question, fourth option was infection. Of course, you're right, Akash. So let's take you further. Now, can anyone tell me the exact question which came in your exam on hypokalemia with hypertension? So all of you, can you exactly tell me what was the question in this paper? Did they tell you about some age of hypokalemia with hypertension, or they did not tell you any age? Are these the exact 4 options which came in your exam? Hypokalemic metabolic alkalosis with hypertension. This question, always comes in your exam. Even last NEET PG, last INICET, I'll tell you what question came in the last NEET PG exam also. Anyone? No age. So Dr. Akila says they never asked age. It was just hypokalemic metabolic alkalosis with hypertension. Okay. And all the options are correct. So students, first of all, I will start from the NEET PG. All of you should know that hypokalemic metabolic alkalosis is seen in many disorders. In the NEET PG this year, the question was on pyloric stenosis. So if you have a patient who has hypertrophic pyloric stenosis, vomiting करने से क्या होगा? Acid is going out. So chronic vomiting causes the same metabolic state. Cystic fibrosis, NEET PG में क्वेश्चन आया cystic fibrosis पे. Cystic fibrosis has hyponatremia, hypokalemia, hypochloremia. So cystic fibrosis में तीनों कम है, sodium, potassium, chloride. This question came in NEET PG this year. There was one option of hypernatremia. So hypernatremia is not seen in cystic fibrosis. Then in NEET PG there was a question that metabolic alkalosis with hypokalemia is seen in pyloric stenosis. Okay. Now we are talking about some kidney disorders. Now remember, in both Barter's and Gentleman's, actually the blood pressure is normal. So that's how we differentiate Barter's and Gentleman's from Liddle syndrome, because in both Barter's and Gentleman's, blood pressure is normal. However, in the Liddle syndrome is also called epithelial sodium cotransporter activating mutation. Liddle syndrome is also called epithelial sodium cotransporter activating mutation. or it is also called mutation of the amiloride sensitive channel. This channel is amiloride sensitive. So remember, Liddle syndrome is hypokalemic metabolic alkalosis with hypertension. Okay, Liddle is hypokalemic, hyperchloremic. So I should not mention chloride here because chloride was not given here. So let's not talk about chloride. Let's not talk about chloride because that will make. So remember, mostly the chloride will be low. So I'm sure in your exam also they did not talk about chloride. So remember, in Liddle syndrome you have the same metabolic state, hypokalemic metabolic alkalosis with hypertension, and the drug of choice is amiloride. What is Gordon syndrome? So Dr. Mathiasu agrees with me. These were the same options. Gordon syndrome is type 4 RTA. It is type 4 renal tubular acidosis in which there is hyperkalemia. So Gordon syndrome is type 4 renal tubular acidosis with hyperkalemia. So remember, Gordon's has hyperkalemia. Okay, let's take you further. Now there was a question of karyotype in your exam and they marked chromosome number 13 and they asked chromosome 13 is which type of chromosome. And students, in every genetics class of mine since last 20 years, I've been telling about Down syndrome. And in every class of mine, I tell you that almost 4 to 5% of Downs are Robertsonian translocation. 4 to 5% of Downs are Robertsonian translocation. Robertsonian translocation is a translocation between two acrocentric chromosomes. In our body, two groups of chromosomes are acrocentric, 13, 14, 15 and 21, 22. 13, 14, 15 and 21, 22. Okay. So remember, group D and G are acrocentric. D and G are acrocentric. Okay. So, 3 to 4% of Downs can be Robertsonian translocation. So you can have a DG translocation, DG or GG. GG, 21, 21 translocation, 21, 22 translocation. So there is no doubt about this, that chromosome number 13, 14, 15, 21, 22 are acrocentric chromosomes. No doubt about that. Okay. Simple question we have always told you in our classes. There's no doubt. And if you ever read my genetics notes, you'll find this in the genetics class. Okay. Now a very basic question of splenomegaly. So all of you, was this question in your exam? Splenomegaly is not seen in? Splenomegaly is not seen in? Of course, all of you know that this is the basic text of hematology. Any book, any medicine pediatrics book will tell you that splenomegaly is never seen in aplastic anemia. Splenomegaly is never seen in aplastic anemia. No doubt about this. Okay, let's move on further. A very basic question this was. Now the next question was, and can anyone tell me in this question, did they tell you about the age? They told a child has chloroma. What is the next step in the diagnosis? Or did they give you any age? And what were the 4 options in your exam? Child has chloroma. What is the next step in diagnosis? Anyone? And what were the options in your exam? Anyone? Are these the right options before you tell us the answer? Dr. Health Shine Plus in Life, huh? Or Dr. Killer? Same? Okay, Dr. Appleby is saying the same options. So students, remember, chloroma is usually seen in myeloid leukemia, AML. Chloromas, extramedullary hematopoiesis, they are multiple, they are at multiple sites. They are usually seen in myeloid leukemias. Okay, so if you ask me what will be my next step, my next step will be two things. My next step will be two things. Number one, I will do a peripheral smear to look for the blasts. I'll do a peripheral smear to look for the blasts. Number two, I'll do a bone marrow and I will do a flow cytometry to look at the lineage, myeloid lineage markers of these WBCs. Okay, so my step will be a peripheral smear to do a bone marrow to look for the myeloid lineage of these cells, of these WBCs. Okay, so Dr. Akila is saying that patient had bilateral proptosis. Of course, bilateral proptosis and chloromas are common in myeloid leukemias, and you need to do a peripheral smear to look for the blasts, and then do a bone marrow immunophenotyping, flow cytometry to confirm the myeloid lineage. Okay. Of course, the most appropriate step will be a flow cytometry and immunophenotyping, Dr. Health Shine Plus, whatever this means. Okay. Why don't you change your name and come with your own name? Okay. I'm on YouTube with my own name today. Okay. So remember, that would be the best test, and immunophenotyping and flow cytometry. Okay. So the answer was peripheral smear. Now students, was there a question on neonatal meningitis? Was there a question on neonate with seizures? Anyone in the class? Was there a question on neonate with seizures? And what is the most common cause of neonatal meningitis? Good. Good, Swaraj. Was there a question on neonatal meningitis in your exam? And can you tell me what were the other options? Okay. So what were the options? What were the four options exactly, Dr. Rakhi? Okay, Kamal is saying there was no question like this. Okay, Rakhi says Listeria, Neisseria. So Rakhi says this option was not there. Okay, so what was the option? Investigation of choice in meningitis, CSF or CT brain? Of course, a CSF. So if they asked you about neonatal meningitis, so remember the answer would be either the most common cause is group B or D streptococci, followed by E. coli. And remember Listeria, if these two were not the options, then Listeria is notoriously known to cause neonatal meningitis, which is very severe neonatal meningitis. So then my answer would be Listeria. Okay. However, the most common cause, Dr. Rakhi, would be strep group B or D strep A galacticae. So you are right, Dr. Rakhi, that neonatal pneumonia ho. Now someone is saying it was pneumonia. So we are talking about meningitis. In meningitis, it should be group B or D streptococci. Okay, then you were right. Okay, so that was all about the pediatrics. I can tell you today that there were almost 12 questions which came from pediatrics. and all of them were from our notes only. There was nothing. These were, in fact, I would say these were actually simple questions of pediatrics. Okay, so which you could easily answer if you had, thoroughly revised the notes. And in fact, you don't need to, remember the intricacies of what I told you of rare disorders. These were common disorders. So I am here. If you have any doubts, I'm on Facebook on the DAMS Exclusive Club 2021. I'm there on the DAMS Exclusive Club 2021, and I'm always there on the eMedicos app. If you have any doubts, you can tag me on PDF for PG. You can tag me at PDF for PG on the Facebook. Okay. Now, if question was neonatal pneumonia, if the question was neonatal pneumonia, then all over the world, the most common cause of neonatal pneumonia, what would be, anyone in the class? It would be E. coli. Okay, so gram-negative bacilli. Okay, gram-negative bacilli. Okay, followed by coagulase negative staph. Followed by coagulase negative staph. Abhishek. Okay, so all of you, that was all about today, and I wish you all the best. If you have any doubts, tag me on the Facebook or any other social media platform. Thank you. Good night.